Good morning, my name is Jacqueline Sullivan and I'm representing the Adelaide University. I'm here today to take you through the guidelines of the application of a scaphoid cast. So today we'll take you through all of the products, how to use them and the safety measures that are included. So you'll need to get all your products out ready. The slab that we have here is a 15 centimetre gypsona and the number of layers you will need are 10. 10 is the set standard for the Royal Adelaide. It can go 6 to 8, but we prefer 10. You'll also need another piece of gypsona that you have folded into 3 or 4 layers and that you have a split in the middle. Along with that, you'll need some stocking net, which is a size 1, and that will go over the thumb. That as you roll that back, it goes down just to the middle, and that's as far as that will go. That's the perfect size for the thumb, and then we have a size 2 for the arm. For your padding, which is very important, we use a soft band padding. We have some bandaging crepe, a tape measure to measure our length of our casting splint that we'll need, a padding to put the elbow on, and a pen to mark your areas. So once you've got everything ready, including your water, and the water should be at room temperature. The reason we do the water at room temperature is when it mixes with the gypsona, is that it has an exothermic reaction and it creates heat. So we'll pop our patient's elbow onto the padding here and then we'll take a look at the patient. What we need to do here is make sure that they are neurovascularly intact. So we're feeling for warmth or coolness in the arm. If we find that the arm is cool and sweaty, we need to stop what we're doing and seek further help. If the hand is nice and warm and the skin colour is good, then continue on. So what we're looking for next is actually any skin integrity that may have been broken. So we're looking for any wounds that may be there, any KYs that may be sticking out, or any bony prominences once you put an arm into position. The next thing we're looking for is to make sure that there are no IV lines, no tags, nothing in there that would actually protrude into the cast and cause issues. So once we've made sure that the skin is all intact, we then pop our patient into position. So the position we want for that, you can take a roll and pop it into the hand. It's like a drink, holding a can of drink. So we hold the hand like so, and then we slide that out gently, and that's our position there. So that's where we try to keep the patient. Next we take our stocking, which is a size 2, and again we roll this up to slide it over the hand. If you lose position, it's quite all right. You can put that bandage right back where you had it. That's not a problem. So we take this up to the middle, give it a little twist, and make a hole. We then pop the thumb through. The important thing here is making sure that the hole is not too big because your plaster is going to come up around your thumb. So we roll that down gently like so. Just making sure that everything is covered and there are no creases. Next we take our thumb piece and we've cut a little piece down the side, like so, to make sure we've got the wider bit at the bottom. And we slide that over the thumb. We take our tape and we secure that piece to the stocking net. Making sure we've got no open skin on view. We don't want to stick the plaster onto the skin. So nextly we're ready to take our back slabs, and the piece we're going to apply is the little pant piece, the little shorts. So what we're doing once we've cut that is we're just going to measure the length, and what we want to do is make sure that once we've put it on, it starts at the mid of the knuckle, the joint here, and goes down to the base of the thumb. So that's about the length that we want. So we've got that. Then we take our slab and we just make sure that our slab is also at the correct length as well. So we know those are all correct. Now we'll go and put some padding on. So we take our padding and we start around the thumb and we circumference the thumb like so. If you get any pieces sticking up there, don't worry about that, you will collect it. Also make sure that you are clear of the metacarpal heads here so that once the fingers are bent up and down, they're not being hindered. If you make this padding far too long and come up over here, then your back slab's going to grow on you. So also make sure you're aware of your edges right from the start. Come around the hand twice, making sure you've covered everything, and start making your way down. I'm just going to come through that thumb space again. And we start making our way down. So we do almost like a 50-50 wrap, not quite, just work it so that you are overlapping some of it. The arm is not a complete cylinder, so it's pretty hard to get a 50-50 wrap, and there's 2 wraps around the bottom. So that's what we're looking for there. So next we take our little shorts, as we say, and we'll give them a quick dip in some cool water. Let the water drain out. Lay that down just to make sure we get all the gypsona into the linear weave of the fabric and that we don't have any creases. So now we're going to take the pants and put them in here. The reason we're doing this type of splint is that we just want that little bit more thickness through here, just to give it a bit more strength. So we just want a little bit more strength through the base of the thumb here, so that's why we've done that. You may as well, while you're here, just take that stocking down and make sure the thumb can bend. We then take the next piece that we've got in our slab, our straight piece here, and we give that a dip in the water as well. Let the water drain. Place it down on our flat surface and just get all of that gypsona into that weave. So making sure we've got no creases, and then place that like so. Just keeping an eye on the position at all times, making sure that you haven't lost position. Keep your fingers out of this. Take a few minutes to just smooth it down with your hand, not too long, because it will be crack set in 3 to 5 minutes. Bring that down. So now we've made sure the metacarpal heads are free, the palmar crease is there, and we'll just do another quick check on that position to make sure we're good. Patient can hold that for a minute or two. Start with the bandage and start working your way up, making sure you've got an adequate tension to hold that back slab in place. Remember, a back slab is a supporting slab that helps to keep the fracture in place and reduce pain. So come on up through that space, around the thumb, and back down. Like so. Last piece of tape on there, just to hold that in position. Now just do a quick check for your moulding. So your moulding is what we call a biker's grip. So we want to make sure that that wrist is back. So you might need to push with the back of your hand to make sure that wrist is cocked back. And what you're doing is actually moulding around the base of the thumb and in between the index finger and the thumb. So we get the patient to keep their hand there like so. And you can use 2 layers of the crepe bandage if you wish, but we find that this easy cohesive bandage is actually a lot better. It keeps the splint in place, keeps the bandage nice. As usually within about 24-48 hours, this bandage loses its elasticity and the cast becomes loose. So we just pop that on, and this is just pulled out at a loose tension and laid down. Don't pull it too tight because it has elastic in it. So in recap, it is important to make sure that you have the right patient, that you have the right back slab for the particular type of fracture, that you give the patient adequate pain relief prior to starting, that you gather an assistant to help you put on the back slab. Make sure you have the correct equipment ready to go. Make sure that you have done a skin check. Also, a neurovascular check prior and post application. And importantly, have a consent verbally from the patient to the application of a back slab. Thank you.